can you see the main screen?
No.
Yes, now.
Yes, hello. Can you see the main screen of my presentation?
Yes. Yes.
Yes, okay. Move to another room, so I may have some problems, but in a moment I will continue. It is disruption of the normal vaginal ecosystem. So it is connected with alteration of and a decrease in normally saprofiting lactobacilli and growth of other bacteria. Normal physiologic, this the vagina contains cervical mucus, endometrial fluid, fluids from Skin's gland, Bartholin's gland, and exfoliated squamous cells. Normal pH of the vaginal physiologic discharge is about 4, so between 3.5 to 4.5 during reproductive years, and a bit more base, so 6 to 8, approximately 7 after menopause, and it is connected with lack of estrogen. And what are the common causes of vaginitis? It is in most cases bacterial vaginosis and candidiosis, and it may be as well as those two situations, it may be trichomonas infections. Bacterial vaginosis is up to 50% of cases in all ages. It is caused by anaerobic bacteria and Gardnerella vaginalis. And trichomonas infection is only about 15 to 20% of cases. It is generally in young women, very active sexually, and it is the cause of this trichomonas infection is protozoa Trichomonas vaginalis. And candidiosis is about 1/3 of all cases. It is generally in premenopausal women, and in most cases, it is caused by candida. Differential diagnosis of vaginal infection. So look at the diagnostic criteria. First, vaginal pH. Than 4.5, trichomonas is more than 4.5, and candida vulvovaginitis is less than 4.5 usually. In normal vaginal discharge, it is thin, homogeneous, white. It is yellow-green, frothy, adherent, increased also in Trichomonas vaginosis, and white, curvy, cottage cheese-like, sometimes increased in Candida vulvovaginitis. The amine odor of KOH with test is absent in normal discharge. It is absent in Candida vulvovaginitis and maybe vaginosis, and is in most cases present in bacterial vaginosis. The main patient complaints in bacterial vaginosis is a lot of discharge, so increased discharge, bad fishy odor, wears after sexual intercourse, sometimes itching. In trichomonas vaginosis is also frothy discharge, bad fishy odor, pruritus, is generally itching, burning, and this cottage cheese-like discharge. Microscopic evaluation in normal discharge, normal vaginal discharge, is normal lactobacilli and epithelial cells. In bacterial vaginosis, you have clue cells with adherent coccoid bacteria and no white blood cells. In trichomoniasis, you have trichomonads and very huge infiltration with leukocytes, more than 10 per high power field. And in Candida vulvovaginitis, under microscope, you see budding yeast, hyphae, pseudohyphae, which is really the real differential diagnosis among all vulvovaginitis reasons. What is the common treatment in patients? So it's general, if you have yeast infection, so candida infection, you may treat the patients either orally or topically intravaginally. The drug of choice in yeast infection is oral fluconazole in a single dose of 150 milligrams or sometimes 200 milligrams. Sometimes the treatment may be repeated. If in terms of topical intravaginal treatment, you have all azoles, clotrimazole, miconazole, terconazole, and other azoles, and they are in the form of either cream or ointment or intravaginal tablet. Is metronidazole. You give oral metronidazole for 2 grams in a single days or 5 milligrams for 7 days. Remember that tablets contain, so you should give the patients in a single dose 8 tablets of metronidazole. If you treat the patients for 7 days, you give 250 milligrams. In bacterial vaginosis, you also give antibiotics, and they are either metronidazole, 500 milligrams for 7 days, or intravaginal clindamycin cream or metronidazole gel. But we usually prescribe metronidazole as the first line of treatment because of the price that is really low for metronidazole and quite high for clindamycin cream. So it may be both treatment or intravaginal treatment. Generally, you do not need to perform microscopic evaluation of the vaginal discharge because it's very, very typical for each kind of infection. So as I mentioned, when you have candidiosis, you have cottage cheese-like discharge. When you have bacterial vaginosis or you have trichom, a bit yellow or a bit green, but it's generally increased. Very helpful in the diagnosis is pH assessment. So you have special bars that measure pH of the vaginal discharge. You may use it during typical gynecological examination, And you clearly see that if you have more acidic pH, it's probably yeast infection. If you have more base pH, it is either bacterial. Histopathologists who assess pap smear from the cervix. So if you have typical overall assessment of the pap smear that it is negative intraepithelial lesion nor malignancy, but you have in the describing specific part of the result, you have the information that there are, for example, a lot of Candida albicans, or you have information that there are Trichomonas protozoa, or you have information that there are a lot of clue cells suggesting bacterial vaginosis. So this pap smear may be also important. Sometimes the Trichomonas infection is diagnosed in urinalysis. So in urinalysis result, you may have the information that there are a lot of Trichomonas, and this patient needs to be treated with metronidazole. Always in case of Trichomonas infection, you have to treat both the patient and her partner, sexual partner, because it's very, very helpful and it prevents the recurrence of the trichomoniasis vaginosis. You do not have to treat the patient, the partner of the patient, but you have to ask them not to have sexual intercourse during the treatment. Now there is a term like atrophic vaginitis, which affects a number of postmenopausal women, and it is the disease caused by estrogen deficiency. So remember that in women of estrogen decrease because the ovaries are small and they do not produce any kind of hormones. Both estrogens, progesterone, as well as testosterone production is very, very decreased. What are the symptoms? Dryness, itching, burning, dyspareunia, pelvic pressure, yellowish green discharge. The findings of the pH is usually more than 5, which is very typical for postmenopausal women. There is decreased superficial cells and decreased number of leukocytes. The treatment of atrophic vaginitis contains both vaginal and oral estrogen. How do you treat these patients? First of all, you should start with vaginal cream or vaginal ointment or intravaginal tablets containing estriol. If it does not help the patient, you may switch to oral treatment with hormonal replacement therapy. But this is systemic and it needs for both patient and the doctor to be more careful about side effects of such. You have to take care about pap smear. You have to take care about ultrasound of the breast, even mammography. You have to check the liver enzymes just for not to the estrogen dependent cancer that may develop during such prolonged treatment with oral estrogen, so generally hormonal replacement therapy. Okay, and that's all for today. Do you have any questions regarding vulvar cancer or atrophic vaginitis?
No questions, doctor.
I have to take the picture, the print screen of you. Okay, I have the picture. So thank you very much for your attention for today, and see you during classes.
Thank you. Bye.
Thank you, doctor. Have a good day.